Mr. Charles, I'm really glad that you brought this to our attention today.
Doc, this does not look good at all, right?
No, it doesn't actually. That is quite the foreign matter here.
Oh, that's a funny tingling sensation you're giving me right there.
Also, how did you get that underneath your fingernail so deeply? This is a huge piece of I don't even know what this is. What is that?
Well, I mean, I was in a trench, and it was really muddy out there, so I couldn't quite figure out what could possibly went in there.
I am amazed, honestly. This is really quite... Okay.
Oh my God, the tingling sensation though.
Yeah, exactly. Oh. And I'm glad you're saying it that way. Here's my thing. If anything at any point during this consultation hurts, please let me know. As long as it's a pressure or a tingling,
okay,
you'll be fine. But if you have any kind of pain, I need to know immediately just so we can reassess the situation and attack it in a different way.
Gotcha.
Wonderful.
Have you seen something like this in the past?
I have, but I'll be honest, I've never seen anything of this size before. This is quite frankly one of the largest I have ever seen. So I don't know whether to be concerned or congratulate you, because that is quite the feat.
Well, I definitely don't want a trophy for this.
Well, I don't. The only thing you're going to get from this is perhaps a souvenir from whenever I remove it, and I'll give it to you to take home. Oh, the good news is it's moving very, very quickly.
Wow. Yeah, I feel it. I feel it right under my skin how it's moving.
Right. It's so important to make sure that we keep it well lubricated. So I'm going to use just a little bit of petroleum jelly around the outside just to make sure that we don't have to worry about that. The less friction we have, the better.
Whoa. How long could this thing be?
My question is, how long has it been there? Was this a relatively recent?
I think it happened 2-3 days ago, but
okay,
when I woke up today, I have to come to the doctor.
I'm really glad you did. The thing is, especially with something like this, you have to be so careful to watch it for infection. Luckily, all of the skin around it is very, very healthy. Like, I'm not noticing any redness. I'm not seeing any sort of like swelling. You have pretty large hands already, so it's not that there's any kind of like outsized digit, which is good. All I see is this piece that we clearly have to remove because it does not belong here, especially not under your fingernail. Oh my gosh.
Interesting. No. Yeah, I've been icing it the past day. I thought that was going to help it.
No, it clearly has, because if you had not, I think that the swelling would be much, much better, or much worse, honestly. And what you have here is honestly very healthy skin. It's got a really healthy tone. It matches all the other fingers, your hand.
I've been lotioning it too.
So good.
That's another thing that whoa.
Oh, wow, yeah.
I felt it move.
I saw that move
that
too.
That was wild.
The thing is too, I'm not exactly sure if this, I know it's organic, but I'm not sure if it's live. So I have to be very, very careful when I'm removing it to make sure that it doesn't break.
So has something like this broken in the past?
It has, and that just makes it more difficult to remove, because if it's broken, that makes an issue for removal. But if we get it all out in one piece as quickly as this is moving, it'll be really, really fast, and we don't have to worry about any infection, not nearly as much as if something were to break off inside.
Gotcha.
And you're still feeling okay, right?
I can only describe the sensation. It's like, I don't know how to even explain it, but it's tingling and
wonderful. Usually it's a pressure, because we've numbed the area really, really well. Like, I was making sure that we put plenty of lidocaine in the general vicinity of the obstruction. So you shouldn't be feeling any sort of pain, but it wouldn't surprise me at all if the sensation you're feeling is more like a pressure or even a tingle. And as I remove this obstruction, it's probably going to feel like deep inside.
Yeah, no, Doc, I clearly, you did a really good job with the numbing.
Good.
Because as soon as you gave me that shot, like,
good.
It just felt like it went to sleep.
Perfect, because that's exactly what I want. The last thing I want is for you feeling any of this, because this can be a really strange sensation.
It's just, whoa. that whole little circling around, wow. That's funny feeling.
Well, you know, they say it's not the size of the boat, it's always the motion of the ocean. So I just want to make sure that we take very, very good care of it, but also as long as you don't pull straight out, you have to sort of approach it from maybe even like a diagonal and or a spiral motion.
Right.
That will help remove it much faster. It'll also help remove it in its entirety instead of worrying about breaking it off in segments.
I hear you.
So.
Yeah, I think you've done this plenty of times. I feel how finesse you're doing this.
Well,
like, you look like This is not your first rodeo.
It is not. And I tell you what, this is a great wrapping job too. Whoever administered your first aid did a really nice job with the bandaging.
Oh, really? Yeah,
Yeah.
this was my sister. She did it all.
Well, if she ever is thinking about going to school for nursing or even medicine, please let me know, because she's doing a great job with what I can see. Her triage job on your injury is outstanding.
Oh, wow. Well, I'm gonna run it by her because, yeah, she seemed like she kind of enjoyed doing it.
Good. Well, she's really good at it. And because she wrapped it so well, I think that your likelihood of infection and or breakage is probably a lot lower.
Oh,
And
wow.
that's-
So I should thank my sister for half of this.
Yeah.
Wow.
Because usually whenever we see an obstruction this size, there's usually accompanied by a lot of swelling, discoloration. You'll have bruising and probably seepage around the entrance or exit point. And I don't see any of that here. And a lot of that is due largely because of the way that she bandaged your hand.
Interesting.
Yeah, she's really excellent. Oh, good. See how fast this is coming out?
Yeah.
I'm not sure exactly how long it is, but I am thoroughly impressed with how quickly our progress is.
Coming along, right?
Yeah, it's really doing
well.
well.
Whoa.
Yeah, so carefully.
How much? That's stretching, though.
Yeah, that's why I'm so
Wait,
careful.
went back in. Did it go back in?
Just a little bit, because there's, like you were saying with that stretch, it's going to bend and also flex right back into the hole, because it's very warm and moist inside this orifice, and pulling it out is not exactly what this piece of debris wants to do. It prefers to stay inside the warmth and the moisture. So we sort of have to coax it out ever so carefully, ever so slightly, just bit by bit by bit. If we try to get in too much of a hurry, it will break. And if it breaks, well, that's really not great news. So we're just going to do this very, very carefully, very slowly.
So you got me concerned, Doc. If it breaks, do we need to perform another type of procedure, or are we just going to continue?
It will be something similar to this. If it breaks, these long nose pincers, I'll actually have to go down into the wound itself.
Whoa.
Right. That's why I'm trying to be so very attentive to this and working it so slowly, so it will make just ever so incremental progress, so we don't have to worry about that. I'd rather just have everything come out easily and quickly, like we're doing right now, like it's coming out right now.
I'm mind blown how it just slides right back in. Like
it's
like
you
a
said
bungee,
it,
in a
exactly
sense.
like that stretch. It's not surprising that many nematodes, many worms, many tapeworms, parasites will have a lot of that flexibility, because that's how their motility usually works. It's that flexibility that moves them along, whether on the ground, through the dirt, or in matter, organic matter. And that's what we're dealing with here. Your finger to this specific creature is organic matter. And it's very warm, it's very moist on the inside. It's been very comfortable inside, but now it's moving day. It's time to get out of there.
Someone's not paying rent. Someone needs to leave.
Exactly. No one stays for free, friends. Oh, you're doing great. Now, this still feels okay, right? We're not having any
I'm completely
pain or
okay.
discomfort? Wonderful.
Now my biggest concern now is, like, am I gonna have a big scar after this, or?
Well, that's the thing. When we finish, we're going to put some stitching in there as well.
Okay.
Like a lot of times, I do a lot of pimples and cysts and blemishes and that sort of thing. And if the pimple is too large, or if the cyst is too large, I will absolutely put some stitches in there. And I think that's probably going to be our best chance of keeping the scarring to a minimum.
Gotcha. Good. Yeah, 'cause I hate scars.
Yeah,
I know they say chicks love scars, but I personally don't think
Well,
they
buddy,
do.
here's my thought on the whole thing about chicks and scars. I think that if you've got a good personality and something else to offer them, a scar is probably just not really anything you need a lot of. You seem like a nice enough guy. You okay?
Yes, I'm fine.
Okay,
I'm just still
good.
like, that's nearly like half an inch. No, that's longer than
It's
an
longer.
inch.
Yeah, it's coming out really quickly too. I'm kind of surprised how quickly this is all progressing.
Oh, I can feel it moving.
Right?
The inside of my
All
finger.
that sensitivity on the inside.
Yeah, like right there. Yep.
Yep.
Bullseye.
Okay, good. I just want to make sure we've got that okay.
No concerns on that, though?
No, not at
No,
all.
no.
Again, there's no seepage, there's no blood. If I were to see any sort of bodily fluids, I would be a lot more concerned than I am right now. This is actually going very smoothly. It's going very quickly. And I'm really pleased with our progress so far.
Yeah,
This
I'm
is
surprised
great.
how quick this thing is coming out.
What I'm going to do is put these aside for the moment. I
Okay.
have this really specific pair of scissors that I will put just a touch of petroleum jelly on the end.
Wait, but those things like literally clamp.
They do, and that's part of what I want to do. What I want to do is just grab it right down here at the base and try lifting with this for just a moment, just to see how that progresses, if any faster. Oh, yep.
Oh,
Exactly.
look at that.
That's exactly what I
No
anticipated
way.
to happen. It's going to come out a little bit faster, and it was already going really quickly.
Wow.
So-
Day-night difference.
Right?
Oh my God, how much longer could this be?
Very quickly. Like, that's just it. I have no doubt in my mind that it's going to be coming out any second now. This is perfect.
I am mind blown how long this thing is.
I really am. It has taken up a lot of space in your finger, sir.
Oh my God.
I'm just glad you came as quickly as you did. Some people will leave this to fester. They will leave it thinking that it will just heal itself, and that is rarely the case in these kinds of instances.
Are you serious? Why would someone do something like that?
People don't have insurance, or people are afraid of doctors, people are afraid of pain, and they'd rather it just hopefully work out on its own. Sometimes they're lucky, and that'll be exactly what happens. And sometimes they're not lucky, and they'll get infections or swelling or pain. And it's just, how people view their own doctors and healthcare and those kinds of things, what kind of priority it takes in their lives. I'm really happy that you came to see us.
Well, I'm glad I didn't wait longer than what I did.
Right. Here. Oh, yeah, there we are. Good. Perfect.
Oh yeah, it feels like it's loosening up right now.
I can feel it. Yeah, it's
Yeah,
got
it's
a lot more
loosening
give
up
in
right
it.
now.
Nice. No, you're doing really, really well. Thank you so much. You're holding still, which is perfect. Now, whenever we finish the procedure, I'm probably going to give you an oral antibiotic just to make sure that the infection doesn't, nothing on the inside. On the outside, we can spot it pretty easily, pretty quickly, but it's the inside that we have a problem with. Sometimes you can't see that as easily, it won't be as visible. Because see, now we've got probably 2 inches of visible obstruction that's
way.
outside the fingertip.
Never in a million years I would think this could be this long,
It's
though.
impressive. It's doing really, really well. Oh, wow, look at that.
That is
But you have to move
bizarre.
it so carefully. But it is moving very quickly, which is good. So it's coming out right now, which is good.
I wish I can explain to you the sensation I have right now. This
I
is
know.
like,
It always has such a
Bizarre.
specific sensation.
Yeah.
But finding the words for it is always just a little bit difficult. Yeah.
yeah,
There we go. Now I'm going to use the
Make
forceps
sure you don't lose
here.
that, okay?
Exactly.
We have, it's pretty much out.
Every time that I give it just a little bit of pull and get maybe another ½ centimeter, I like to clamp down on it so it doesn't actually retreat back into the finger,
Yes, yeah.
because I don't want to lose any progress. All I want to do is
Wait, so
continue
you tell me if
making
you lose grip, it can go all the way back in?
not all the way back in, but if you let it go of its own volition, see, look at that. We're already at probably 2.5 inches, and we're still pulling. So I'm excited to see where the end of this guy actually shows up. Oh, there we go.
Wow.
Exactly. This is it. We need a 1-2 method. So you've got 1 with the pull, and you've got a 2 with the clamp. Between the 2 of those, we continue to make progress and headway.
Oh, it's a science.
Well, it's a little math, too. That's the best part. So don't forget your STEM classes while you're studying. Make sure you tell your sister.
Well, I definitely don't want to do a procedure like this at home. I'd rather just
No.
come back to you.
And you'd be amazed how many people I see that will come in once they've done this at home. And it never ends well. They do a really good job of extraction, but they don't do a great job of preventing the infection from spreading. You're lucky because you've got a very clean entrance wound. There's no seeping, there's no blood, there's no discoloration. Very minimal, if any, swelling at all. This is really a textbook case. All we have to do is remove the foreign body and you'll be ready.
Well,
And it's happening right now.
Whoa. I think this is thanks to my sister, Jules. I mean, she did such a good job taking care of my
Honestly.
finger with ice in it and band-aiding it.
If she ever feels like
Whoa,
volunteering
it's still coming.
until we can get her a nursing degree, I highly recommend it because this is absolutely some of the best wrapping I've ever seen.
Interesting. Well, I'm definitely gonna run it by her.
Good.
Because as the facts speak for themselves.
Truly. And
This
I mean,
is-
I can't tell you how much pain she saved you by doing this so effectively. Look at that. How in the world did you
I am
get
mind
such
blown.
an
How
incredibly-
much longer can this be?
I don't know. But it just keeps coming quickly, which is great. But it's just like, seriously? So much of this. I'm surprised you didn't feel it in the back of your hand. This guy is enormous.
Right? It's longer than my finger by now, I think.
I mean, honestly. And it's nearly as thick. Look at the circumference of this giant body. Look at that
That's
thing.
wild. If I was to ever mention this,
Mm-hmm.
I feel like I would be lying through my teeth. But this is really happening?
I'll tell you what I'm going to do is I'm going to give this specimen to you whenever we finish with the procedure.
Can you make it like a keychain?
I'm going to let you figure out what you want to do with it. I'm going to put it into a very specific biohazard plastic bag. So whenever anyone asks you about this, you can say, I don't have to tell you, I can show you because the doctor gave me the specimen itself. Look at that. We're operating on probably 4 inches of foreign body right now.
I think we're exceeding the length of my finger by now.
That's what I was thinking. I was like, it probably went into the back of your hand as well, unless it was coiled.
Whoa,
Like
I can still feel it. I can still feel it.
And
dude.
there's still no pain, no
pain,
tension?
but I just feel it. It's like a
Great.
tingling sensation.
Good. Because the last thing I want to do is have any sort of pain whatsoever. I take enormous precautions to make sure that my patients are always comfortable.
Yeah. I mean, right
Just
now,
look at that
like,
thing. That is crazy.
that's wild.
That is amazing to me.
Make sure you have that thing clamped really well.
I do.
I would not want this thing to slide right back in.
No. And the best part about this is we're there. Like, I can tell that we are getting to the very end of this. So we've been working on it for a moment, but we are
doing good,
almost
Doc.
out of here, which is the best part. Ever so gently, but firmly, and clamp to make sure nothing goes back inside. Firmly.
Wild.
Gently. Oh my
It's still coming.
Okay, here we go.
Okay,
Almost there.
Oh, it
I can
feels
tell.
like it feels like we're right on the tail end of
We
it.
are so close to the end. I
Oh
can
yeah.
feel
Oh, you got that one
it.
real good.
Okay.
Yeah.
Here we are. Okay, one more
That's-
pull, one more
okay,
pull, one more pull.
okay. Whoa.
Okay,
No,
hold on. I cannot take the risk of this thing breaking, okay?
my
One
God.
sec. My
How much
gosh, what is
longer
that?
can this
Like
be?
5 inches at least.
Wow.
Jeez. And thick. Look at the size of that guy. What in
Wow.
the world? I mean, jeez, I don't know what you did.
Whoa.
Oh, here we go.
It's coming.
Here we are.
Oh, so easy.
Oh, okay, clamping.
Oh.
One
Don't
more,
lose it, don't lose
one
it.
more.
Don't lose it. You got.
Go! My gosh.
Oh!
What in the
Oh.
world?